the ambulance is booking here?
The ambulance is booking here, and then the patients then will come through into this area.
Here in Cardiff, at the University Hospital of Wales, they're about to revolutionise the way they provide emergency care. They are the latest hospital to join a movement that are looking to abandon the traditional approach of admitting emergency patients to hospital.
A lot of these patients, I think, would suit the ambulatory unit.
Instead, they are going to provide ambulatory emergency care for over a third of patients. This will improve their emergency system, making them much more efficient, effective and improving patient outcomes. What is interesting about this change is that it's been facilitated by a network of doctors and nurses who have seen the need for change and have been frustrated by how slowly it has been happening.
Clearly there's a problem with accident and emergency departments nationwide. This was evident with long waits and crowding.
The hospital was in gridlock almost every day in winter, where you would have an entire emergency department full of medical patients who were all waiting to progress through into the hospital, everyone needing to have a hospital bed to start treatment. What we needed an outpatient environment where we could provide some of the hospital facilities and treatment and diagnostics away from the need for hospital beds. And we also needed a place where we could provide some limited treatments where patients would get high quality treatment without the need for a hospital bed.
And this was how the concept of ambulatory emergency care started to evolve.
In a conventional emergency department, patients needing treatment are admitted to a ward as an inpatient as soon as a bed is available. With the ambulatory care model, patients are assessed on arrival, and those that are suitable are routed through to an ambulatory care centre where they can receive diagnostics and treatment and go home the same day.
The key question was it safe to do this? And we decided to try and find out by trialling it with patients with deep venous thrombosis, cellulitis, which is an infection of the legs.
We weren't a trailblazer in this. It was well established that you could treat DVT in the community. It was becoming more established that you could treat low-risk pulmonary embolus in the community. Cellulitis, we already had a pathway whereby we had community teams going in and delivering antibiotics. And part of what we did in ambulatory care was unify a lot of those services.
We trialled it and found that as we expanded the number of clinical presentations we could manage through ambulatory emergency care, it remained safe and it was of great satisfaction to patients.
But ambulatory emergency care was initially slow to catch on. There was a general reluctance to embrace change, even when the need for it was patently clear.
So we're going to give her some ertapenem, is that all right? And then she can probably go home after that. Consultants are taking a lot of risk when they see patients anyway, and you're asking people to change the way that they practice. Conventionally, people would be watched in hospital in what was thought to be a relatively safe environment, and that small changes in their health could be reacted to and treatment changes made. You remove that security and people feel nervous about it.
Initiating change is always a challenge in the NHS, but national support networks can help the process, and one was set up for ambulatory emergency care.
When we're working with organisations, we often find that there are a small number of individuals that are very keen to adopt this new way of working, and one of our key roles in the network is to support those individuals, give them some mentoring and support.
Early adopters of ambulatory emergency care shared their experiences with the rest of the network.
So we had chairs down here on the left. This was our reception area.
Among them was West Hertfordshire NHS Trust at their hospital in Watford. They built a new ambulatory care unit next to A&E. Patients are screened on arrival, and those suitable are directed here where they are quickly assessed and tests performed. They are then seen by a consultant, diagnosed and a treatment plan initiated. Treatment can often be started the same day, with follow-ups provided on an outpatient basis. Only around 10% of patients are actually admitted to a ward.
One of the benefits to the organisations is the return on investment, in that they will see a reduction in patients admitted to hospital, a reduction in the bed days used, and they will find that their staff in emergency departments in acute medicine are more satisfied with the job they're delivering.
In terms of the numbers of patients that are going through the ambulatory service, we're looking at avoiding 20 to 30 admissions per day, with those patients often having a length of stay of over 2 days. So it was very apparent very quickly that the business case would be supported.
The take-up of ambulatory emergency care has gone viral. This started off as an unusual service in a small number of hospitals. We're now on to cohort 9, which means we're up to nearly 100 sites across England that have been through our network of ambulatory emergency care. Ambulatory emergency care is safe, it's cost effective, it's got better patient outcomes, and patients love it.